Your Royal Highness, ladies and gentlemen, dear colleagues and friends from all over the world, always wonderful to see this family together. At the end of this impressive lineup of speakers who talked about the fantastic developments in the NHS in the UK, I would like to talk about a little bit different aspect of healthcare, more on a global scale, and I'm afraid I need to bring everybody back from the future to the hard reality of life today. A vaccine for every child. That is very important to really guarantee and ensure healthy children in the whole world. Us living mostly in a very safe and comfortable environment, we are mostly not aware that that is not the case for a lot of children and adults in the world, that clean water, the right nutrition, access to health care and vaccination is not the norm everywhere in the world. And many lives could be saved, really, if we could make a change happen there. In working with other organizations in this field, we have learned that the supply chains in developing countries are often very dysfunctional. That is true as well for the routine health system in these countries as for the emergency supply chains when there is a crisis, when we need to bring goods very quickly to people in need. What we have learned is that very often critical products are not where they should be. Vaccines are not there and children should get them. Drugs are expired or on the transport or on the ground. They have not been stored in a way that they are still effective. I had doctors telling me that they in any case double or triple the doses because they are aware that the normal effectiveness is not there when they are treating patients. Inventory management, if you look at warehouses in developing countries, I guess a lot of the retailers in this room would shake their heads, but that's reality on the ground. Traceability, which child has gotten which vaccine, is just not realized in these countries. And last not least, a lot of governments, I know the UK is giving a lot of money to organizations which are really helping these countries, but they also want that the money they are giving is really used in the best way and want to ensure that they have really an effect in these countries. So what we really need is alignment. Alignment of people, processes, policies, and technology. And on the technology side and on the processes, GS1 can make a big differences looking at these important supply chains, which are important really for lives. And we have seen that it works. And why should it not, as we are using barcodes every day? So in pilot projects in some countries, we have seen the benefits of using GS1 standards on products like vaccines with an GS1 identifier for the product, with an expiry date, with a lot number. And the feedback on the ground was very positive. You can see here, Tanzania, we had a project first in one region, Arusha, and on the feedback of this project, the government in Tanzania rolls now out to all provinces, and the Bill Gates Foundation is giving the money to buy more scanners for all these provinces. We have seen a very successful pilot in Pakistan, and we have just seen the publication of regulation for GS1 standards in Pakistan. Ethiopia, the government is looking really for the same GS1 global standards for their supply chain to have overview of what is happening really with their people in their countries. And the same is true for Nicaragua. And more countries are coming on and want to look into repairing their supply chain. The feedback in these projects is absolutely positive. The people on the ground are really happy with an easy way to use technology. That's the reason also why now WHO, Gavi, the Vaccine Alliance, but also USAID and UNFPA have given recommendations and requirements for global standards to all their suppliers. So they want to see vaccines and reproductive health products identified so that they can be traced throughout the supply chain. And the great thing about this is that they are not only requiring that from the suppliers, but they are also helping on the ground in these countries to get the system in place which can accommodate and can deal with GS1 standards. This is a slide USAID has very recently shown at their supplier summit in Dubai this year in February. And you see how much they have taken the GS1 system on board, identifying products with unique global numbers, capture the information which is with that in a barcode on a product, and share and use this information then with their partners in the supply chain, but also for analysis, what is needed, when and where. But we are also involved in the pandemic supply chain network. So we are working with organizations like the WHO, like the World Food Programme, like the World Economic Forum, to make the supply chain in the case of emergency and crisis, like the recent Ebola outbreak, and it seems we are getting another one, to have really the goods at the place and to know what is where and is there enough stock really in place to provide this critical goods to the people in need. And GS1 standards can really help to have an accurate and coordinated supply chain where it's visible where the goods are which are needed by the people who need help and support. So we have heard really the wonderful things happening here in the UK, the great progress which is made with Scan for Safety. And I must say, working across the world, the NHS in the UK is really leading the way here. We know that GS1 standards can help to improve patient safety and the life of patients. And I would like to see that happening really all across the world. And I would ask really everybody of you to continue to work together with us to take care that every child who needs a vaccine and needs a medication is getting what they need in the moment where it is necessary, because that is really the basis of health and well-being for everybody. And to close, I would like to close with what we started this morning with in the video, with the words, safer, more efficient care starts with a simple scan, the famous beep, also in the developing countries. Let's make that happen together. Thank you very much.